Assalamualaikum warahmatullahi wabarakatuh. My name is Nurliyana binti Zairul Afendi with metric number of 1610666. I'm going to present my final year project entitled An Impact of Body Mass Index BMI on Inferior Vena Cava Parameters and a Need for a Standardization. And this research study has been supervised by my supervisor, the Assistant Professor Dr. Umi Farhana binti Hashim. Okay, this is the presentation outline. There are six, which are the introduction, literature review, methodology, results and finding, discussion and conclusion. Changes the body volume status by adjusting its diameter based on the volume of the total body fluid. IVC also contributed to the cardiac functions on the right side. Patel et al. 2016 claimed that the IVC measurement gave the most accurate and precise reading according to its arterial system such as pulse rate, blood volume and diameter of the aorta. That is why interpreting intravascular volume status is important for patients with serious illness and trauma such as shock patients and heart failure patients. It is one of the best approaches than getting the central venous pressure (CVP) due to its disadvantages of time-consuming and invasive. And, however, only a few studies establishes the association between the maximum and minimum diameter of the inferior vena cava with a body mass index. So the next one is the problem statement. So what is the difference regarding IVC diameter in underweight, normal, overweight and obese individuals? Any significant difference in IVC diameter and collapsibility index (CI) changes among individuals with higher BMI. So, for the objective of this research study is to establish a standard range of IVC diameter between underweight, normal, overweight, and obese individuals. And the specific objective is to first one is to evaluate the relationship between IVC diameter with CI and BMI, and the second one is to evaluate the relationship between IVC diameter to the literature review, which is body mass index or BMI. BMI is an indicator for categorizing anthropometric height and weight characteristic into groups said by Nutfall 2015. The formula used to calculate the BMI is weight kilogram divided by height squared meter squared. Each individual will be categorized into underweight, normal, overweight, and obese. Therefore, the underweight BMI is below than 18.5 kilogram over meter squared. Normal is 18.5 until 24.9. The overweight 25 until 29.9, and the obese is more than 30 kilogram per meter squared. Meanwhile, for the inferior vena cava IVC, 2019 has mentioned that the inferior vena cava is a large compliant vein which carries the oxygenated blood into the right atrium of the heart. Author also further added that the IVC is uncompliant as the size may vary with different intravascular pressure. The IVC will collapse during inspiration and dilates during expiration, and the acceptable ranges of IVC diameter according to Iles et al. 2016 are from 13 to 28 mm, and the IVC is useful in monitoring volume status, especially in critically ill patients. So, the next one, why ultrasound is important? The point of care ultrasound is the most suitable modality because of its rapidness, accurate, repeatable, inexpensive, non-invasive, and of course without the risk of getting radiation. This is because the ultrasound approach can simplify the decision-making process, especially towards critically ill patients, and it can answer urgent, important questions, said by Abu Zidan 2012. Okay, next, moving on to the methodology. Cross-sectional study and experimental method of study design were used in the study. The study was done from 19 December 2019 to 4 August 2020, which approximately took 7 months from the date of the proposed defense presentation. Data collection was carried out at ultrasound room, radiography and diagnostic imaging lab, at the Kuliah of Allied Science, CAS, IIUM, Kuantan. A total of 61 subjects were involved in the study, involving radiography students instead of 80 subjects because of the COVID-19 outbreak. However, I managed to achieve 70% of the data collection to further continue on this study. The volunteer subjects were among diagnostic imaging and radiotherapy students with the range of age from 21 to 26 years old. The subject also must fulfill the inclusion and exclusion criteria to be included in this research. All these assessments will be thus using SPSS. Inclusion criteria: the subjects must be the diagnostic imaging and radiotherapy students with body mass index from below than 18.5 until 29.9. Those with exhibit the following criteria was excluded from the study. The one who goes under IVC filter surgery, has deep vein thrombosis, DVT, has inferior vena cava syndrome, IVCS, pregnant woman, and also related to any cardiovascular disease. So, next is the equipment and material used for this research study. Of course, to measure the height and weight, I use the portable Seca 769 and also Siemens Acusen X150 ultrasound machine are being used along with 2 to 5 MHz CH5-2 transducer and also ultrasound shell. So, for the study methods, the research information statement and informed consent form were distributed to the subjects before performing abdominal ultrasound scan. If the subjects agree to be part of this research study, he or she needs to sign the consent form. During scanning examination, the B-mode scan probe should be placed at the subpostal region and adjusted until the IVC is visualized longitudinally adjacent to the liver and causing the diaphragm. To validate the IVC anatomy, the vessel found during scanning should follow the longitudinally through the right atrium. Then measure the diameter of IVC 2 cm from its entry into the right atrium just before the bifurcation of hepatic portal vein and IVC junction. Measurement of the IVC during both respiratory phases, which are inspiration and expiration, are needed. With each measurement will be made thrice and the average value is recorded to calculate the collapsibility index. Subpostal view at the mid-clavicular line between the ribs of the right lower chest, 90 degrees perpendicular to the skin. The marker points proximally towards the head. The probe may be slightly directed towards the right to be parallel to the IVC, and it may shift slowly transversely to get the best longitudinal perpendicular view. So, for the results and finding, there are 3 tests being used for this research study. The first one is the normality test, and analysis of variance ANOVA test, and correlation test. Normality test, 5 assumptions are being used. The first one is the assumptions of normality, called Kolmogorov-Smirnov or Shapiro-Wilk test. The reading of the mean, median, and 5% true mean, skewness, and kurtosis, and lastly QQ plot. It indicates whether accurate statistical tests were used. So, looking at the pie chart, there are 4 groups of BMI. The group 1 refers to the underweight subjects, group 2 normal, group 3 overweight, and the group 4 obese. Says that the number of subjects in group 1 and group 4 are the same with 12 subjects each group. Meanwhile, the group 3 has 13 subjects with 21% of total percentage. And lastly, the highest participated subjects are subjects with normal BMI with total of 24 subjects. Overall, the total subject of the study is 61%. Next, onto the gender of the participated subject, only 12 males volunteered in the study and most of them are dominated by females with 49 subjects. Okay, moving on to the assumptions of the normality. The corresponding of IVC and CI histogram from group 1 and group 3 has a standard curve. Means that the distribution is normally distributed. However, histogram for group 4 variables are distinct from each other. It has a right skew distribution. Okay, for the Kolmogorov-Smirnov and Shapiro-Wilk test, we use the Shapiro-Wilk test because each group sample size are less than 50. It is clear that for both IVC and the CI, all groups on the Shapiro-Wilk have a p-value greater than 0.05, with the lowest 0.066 and the highest 0.85, suggesting that normal data distribution. The parametric test is used to further analyze this data. So for the mean, median, and 5% trend mean, the mean, median, and 5% trend mean from variable groups are similar, which is and the skewness and the kurtosis level. So moving on to the QQ plot, the plotted value close to the linear line for all groups is normally distributed. As shown above, all QQ are statistically significant for all group level. The parameter all of the p-value in this table has a more than 0.0. It means that there is an equal variance between four groups. So we can proceed to the ANOVA table. So for the ANOVA, the ANOVA is used to compare the four group subject with different IVC diameter and collapsibility index. The ANOVA table will indicate whether the null hypothesis is rejected or be failed or rejected. So the p-value for IVC diameter are less than 0.001, which is less than the significant level of the 0.05, and it falls under the rejection region. Or the researchers should reject the null hypothesis. It means that there is a difference between inspiratory IVC diameter and BMI. Meanwhile, the p-value for the collapsibility index is 0.452, which is greater than 0.05. It reveals no statistical differences in the collapsibility index. Therefore, the researcher failed to reject the null hypothesis. And it means there is no significant difference between CI and BMI. So this is a table. We can clearly see that there is a statistically significant difference diameter of inferior vena cava between groups that took the group 1 and group 3, group 1 and group 4, and group 3. Meanwhile, by referring to the Danet's method, it found a significant difference, which are group 2 and group 4. So, moving on to the Pearson correlation test at the normal versus underweight. Okay, there is a fair positive correlation between the BMI group and the BSA with the strength of the correlation of 0.494. Meanwhile, the moderate to good positive correlation occurred between the IVC diameter and the BSA with R equals to 0.648. Okay, some of the correlation values obtained between the normal and the overweight groups were statistically significant in the following order. IVC diameter with BSA with R of 0.679, BMI with BSA with R equals to 0.638, and lastly the BMI and the IVC with R equals to 0.470. All of these values obtained were less than 0.05 significant value. The test for correlation between normal and obese group found 3 significant correlation with a p-value lesser than 0.05. The results show a statistically significant improvement between BMI group and BSI with a very good to perfect correlation as the R value is greater than 0.75. Meanwhile, a pair of IVC diameter and BSA revealed a moderate to good correlation with an R value of 0.558, and a fair correlation is found on BMI group and IVC diameter with a R value of 0.454. This are minimum and maximum of IVC diameter on radiography students. We can see that at group 1, the minimum diameter is at 8.3 mm, and it increases on group 2 with 9.9, 3 on group 3, and 14.0 mm on group 4. Group 4 is obese subjects. Meanwhile, the maximum IVC diameter on group 1 is 14.4, group 2 16.83, group 3 19.23, and however, it decreased slightly at the group 4 with 17 and 17.42 millimeter. Finding as the mean IVC diameter increases over BMI group ranging from 8.83 to 19.23. Specifically, this data suggests that BMI increase, the minimum and maximum of IVC increases too. Finding 2, it is broadly translated. Our findings indicate that the strength of the correlations grows better from normal versus underweight, normal versus overweight, and normal versus obese. To elaborate, it goes from fair, moderate, good to a very good and perfect correlation strengths further. Verbraeken and his et al. 2016 mentioned that the weight will lead to a sharper improvement in BMI compared with BSA. This may also be viewed from the perspective of obese subjects excessively storing their excess weight in the trunk and a result the BSA decreases less. Moreover, female individuals may have low BMI and low BSA due to their small body frame. instead of the male. For the finding 3, um, our results consistently with the correlation between the IVC diameter and BSA from all 4 BMI groups with moderate to good strengths of correlation test. It is supported by Neguchi et al. 2015 in their study on patients undergoing right heart catheterization or central venous catheter insertion. The author further elaborate that they find the idea that the body size affects IVC diameter and the needs to break cut-off point for irregular right atrial pressure in relation to BSA. Transabdominal ultrasound appears to be reliable, cost-effective, non-invasive, and simple for monitoring and measuring IVC parameters. And for extract separately for different BMI groups, it has been shown that larger subjects has a greater IVC diameter. This result has been shown statistically significant. The maximum diameter of IVC value is found highest on overweight subjects regardless of the gender. The IVC parameter did show a significant positive results in both BSA and BMI. Moreover, the correlative coefficient between BMI and BSA was strong within the different study groups, suggesting it may be closely related than IVC diameter with both BSA and BMI. Overall, there is a significant association between IVC diameter with BMI and BSA. However, we should not forget that determining the state of body fluid in critically ill patients was the primary explanation for the relationship between IVC diameter and the collapsibility index. Even though this study, we haven't found any significance between the IVC and significant index. The key justification for this research was to provide a standardization of IVC diameter in relation to BMI group on healthy adults representing by the radiography student. Although this study was not widely recognized in the journal, this study may be an intervention or a precursor in other major future studies related with disease or genetic inheritance. So this is the current chart of my research study, and lastly, these references used for this presentation. That's it. Thank you.